We wanted to create a fun, non-judgmental space where women can talk about their shared experiences.
Here, we will normalize the challenges we face as females living in a society that dictates unrealistic and outdated expectations on what a woman should be.
Together, we hope to cultivate a supportive community of women who empower one another to courageously live unapologetically.
A quick disclaimer before we get started. Although Cindy and Danielle are licensed therapists, this podcast is not to be interpreted as therapy or a replacement of therapeutic services. It is strictly a conversation between two women about their experiences in the world. If you like today's episode, please make sure to like and subscribe below. Also, follow us on all of our social media platforms at Unapologetically Females. With that being said, we hope you enjoy this episode.
You know me, I just powered through it, and my body told me.
Yep.
Like, hello.
Yep.
So, interesting. Go ahead.
Sorry. What about rate of babies? Because you were sharing that one night you had a lot of babies born in the same night. Do you feel like more babies are being born now since we're so far out of COVID? Did you see a different
I think there was kind of a lull, but I'm fortunate enough that our practice is always busy.
Mm-hmm.
So personally, I don't know that I saw a big decline, but yeah, we're busier now than we've ever been as a group.
Yeah.
For sure.
Is that, I guess what I'm asking, do you feel like more babies are being born, or do you feel like our geographic, particularly because so many people are moving here right now, increases the amount of...
Yeah, I think it's probably both. But I feel like, everybody's having babies. Thank God. It's good for business.
But you got two to, still raise.
I
one
know.
in college.
Oh. What pays the bills?
Yep.
What has changed as far as trends in
Vajazzles.
I'm gonna maybe have to go into business for that.
I know.
Have it set up a little kiosk in my office. Would you like to vajazzle your vajayjay?
Rita's graduating next month. Rita.
That's what that's your graduation gift?
Yes.
Surprise.
Yeah, surprise. You get to go to Dr. Crum's office and pick out your vajazzle stuff.
I was saying she could be the vajazzler, but
sure,
that could also be your graduation present.
There you go. It's a new service your practice
she's looking
offers.
maybe for a career, but yeah,
Throw
it out the window. Vajazzle.
Yeah. For sure.
I love that we're that's the topic that we really want to focus on.
I just love the word. It's so great.
You
want to say it as much
every
as
day.
possible.
Yes, thank you, Cindy,
you're
for
welcome.
educating me on that one.
Because next time you see anything down there, you're going to giggle a little and think, vajazzle.
Yep.
Yeah.
And then I'll think of you.
Thanks. You're welcome.
Okay, so I'm curious in trends in pregnancy and childbirth.
Oh, there's new TikTok crazes all the time.
Really?
Gosh,
Oh, yeah.
I bet.
Now it's banking up colostrum, ahead of time. That's the new one.
What?
Yeah.
While you're pregnant?
While you're pregnant.
So are they,
nipple
trying to...
stem and they put it in these little syringes and then they freeze it and
Do
then
they
bring
inject it in their face for wrinkles?
No,
or
God, that's probably the next thing.
Sorry,
no, it's
Mom.
for
If it is, I
before
want-
their milk comes in or something. And I'm like, it seems like should I do it? And I'm like, you can. It just seems like a lot of work for very little reward.
Yeah.
They're getting like 4 cc's.
Oh, wow.
wow.
That's the latest. And then placental encapsulation, get a lot on that.
What are your thoughts on that? What?
I don't even know what that is.
Oh, okay. That's your
That's eating your placenta?
Yes.
Oh, yeah.
Well,
Sorry.
I'll never forget when I first, I had never heard of it. This was years ago. And it was one of my partner's patients, and I'm just covering on the weekend. She's like, well, we're going to encapsulate our placenta. I'm like, well, what do you mean by that? She's like, well, you give it to this woman. She's going to put it in pills, and I'm going to take it to help reduce the incidence of postpartum depression. And I'm like, okay. And she's like, well, we're the only species that doesn't eat our placenta. And I'm like, well, I'm also not worried about a bear coming and eating my child. That's why they eat it. It's to get rid of any remnant of odor, Yeah. I'm like, do you. If you want to eat your placenta, go for it. But now there's more information about it, and babies have died from group B strep sepsis from moms who are breastfeeding who were positive for group B strep and they're ingesting that, and now it goes to baby and they can die.
Oh, really?
Yeah. So I advise against it.
Okay.
And there's like zero regulation. Can you imagine? Like you're giving your placenta to some doula who's taking it home and freeze drying it and putting it in capsules, but like she could be doing that on the table where like her cat pooped, or you know, I mean, like you have no idea.
Yeah.
And it could be the girl next door's placenta who, I mean, you have there's zero regulation.
No.
Like that's disgusting to me.
How many people keep their placenta like to bury it or do things with it? Or what's the weirdest thing you've heard of someone doing with their placenta besides eating it?
Like some people will plant trees, which I think is kind of cool. Life for life. Like that I have zero problem with. I think, and a lot of like native populations will do that. It's a cultural thing. And like that, I'm like, go for it.
Anyone can just be like, hey, can you bag that up for me?
Yeah.
Oh.
And they put it in a little container and they'll bring a cooler. But just like a couple weekends ago, I had a patient who wanted to do a lotus birth. Have you heard of this?
No, I have not. Do educate me.
So the placenta stays attached for like days until, you know, like the umbilical cord finally comes off, but that can take days. So they just leave the placenta attached to it, to the baby. So they carry around the baby attached to this disgusting placenta that starts to smell. So they put like potpourri and things on it to make it not smell.
Why do they call it a lotus?
I don't know why it's called a lotus.
So lotus
birth,
is a really pretty flower.
Yeah, I don't know. It just ruined it for me.
What's the purpose behind that?
I don't know, because there's zero clinical benefit to it. Now you're just like increasing the risk of infection. But these people read it online, you know, and like so and so says it's cool, so they're like, I should do that.
Wow.
I talked him out of it, but yeah.
Oh, okay.
Oh, good. Yeah.
Okay.
Good for you.
Yeah.
Good job.
Yeah.
Wow.
Yeah.
Um,
All right. So that's your weirdest placenta story.
yeah.
Yeah.
It's weird. People just find stuff on the internet and they just run with it.
That's
and
what
And
it
they
is.
believe
yes,
it.
they believe it.
Believe what they read.
It's really...
How have you navigated I mean, I know you said it's 90% happy, but 10% sad. And I can imagine delivering babies, it doesn't always go as planned. Yeah. So how have you navigated and like worked through, I mean, for yourself even, you know, and how do you support patients through that when it doesn't turn out the way, you know?
Yeah, I think it's just being real and being human. And like when you have something sad, like it's just... you feel that. Like I've always very much felt that. I've never had the ability to just completely turn it off and compartmentalize because it's awful, you know? And I have a patient who's getting ready to deliver and baby's going to be in palliative care and they know the baby's not going to survive. And like every time I just like hug her, I'm like, I'm just so sorry you're going through this. Like it's just terrible, you know?
Yeah.
But I think you just have to be real and you share that emotion and that's what they want. Like, you know, I'm not going to make it any better. I'm not going to cure this kid and I can't do anything that's going to make the situation any better, but you're just there to support them and, you know?
Yeah.
That's where that bedside manner comes in. And there's nothing you can do to fix it. So, but you can listen and you can comfort.
Yeah. And get them all the tools that they need to be prepared and educated and, but yeah, it's sad. That part is a bummer.
Yeah, I can't even imagine. Like that's that would be really hard. But I think that how you're responding to it and supporting people through that,
it's amazing.
I mean, like I think that's the only way. You know, like to be real.
I think most OBGYNs are very compassionate people like that.
I feel
you know
like,
what I mean?
yeah,
like
I feel like your specialty. Didn't they do a skit on like wasn't there a skit on like Saturday night? Some skit, and it was like, oh, here comes the OBGYNs, and they're all like these beautiful.
Yes, I remember that from Scrubs.
That's what it was.
In the day.
That's
yes,
what
and
it
I was
was
in residency at the time, so it was quite poignant.
Yeah.
And so we'd be like, we need like fans blowing behind us and light coming in.
That's hilarious.
Well, because like 90% of us are girls and OB.
Right.
You know?
Yeah.
Right. Okay, so switching gears a little bit, what about the oddest environment to deliver that you've been in?
Ooh, that's a good question.
Well, a hospital room.
But like what people...
Sorry to be boring.
No, but like how people set up the room. Like, I mean, have you seen some weird stuff? Because I feel like there's different trends of people.
Well, there's my favorite. And there's a certain population that they decorate the room.
Oh,
It's fantastic.
in what way?
Like it'll all be pink or all be blue. They bring in their own sheets and they decorate everything. And they're all wearing matching outfits, like the dad and the grandma, and they'll have an entire, like the whole waiting room is there, and it's all decked out. It is spectacular.
I love that.
Yes.
Is there a way you could like send me like a code word and just be like,
You could,
you know, like
you could go down the
Code
Facebook.
pink.
Yeah.
yeah, okay, yeah,
Code pink?
Maybe I could just, you know, show up
It's
just to see
fantastic.
him walk out of the hospital. Would
Yes.
be enough.
And
yeah.
like they'll do like dress him up in like Gucci, the baby, with like a set, like a big gold chain. It's fantastic.
Oh, I love that.
Yes.
Okay, so
Yes.
what about like the different styles? So like hypnobirth and, you know, all those different, you know, types of birthing experiences. I don't know what else, because I was like, I'm showing up and we'll see what happens. Like,
yeah.
I didn't have like a birth plan. I didn't have like,
Yeah.
Heard of
I mean,
hypnobirth.
I think the actual number of people who do natural childbirth at Shea Hospital, it's a little bougie, you know,
Okay.
high maintenance.
I delivered there. That says
Yes.
enough. There you go.
And I mean, 95% of my patients get epidurals.
Okay.
So there are those 5, and more power to them. I just always say, like, I want your birth experience to be what you want it to be. And if that's how you want to do it, I'll support you. But hypnobirthing is just a way of dealing with the pain, you know? But, and I think for women to really be successful with natural childbirth, they have to have some sort of
Visual
coaching,
Yeah.
or they've done classes, or, you know, to give them the tools to manage it.
strong support partner.
Yes. I always feel the worst is when you get the woman who comes in hot, it's like her 3rd kid, and she's complete. And that was not in her birth plan.
Yeah.
And you're like, look, girl, you just got to do this, because it's going to be
Yeah.
harder for you to sit through an epidural. You just got to push. And they just have this like deer in headlights look, like, you know, and you just feel so bad for them, because that was not what they wanted.
No.
So there is a point of like, it's too late.
Yeah.
What is it? How many centimeters?
It
Usually.
depends.
Depends
I mean,
on the
I don't have
person.
first time mom, second time mom, very different.
Sure.
Like if it's your first baby, you come in complete. There's probably time for you to get an epidural, because you got to push for a while. But like 3rd baby, 2nd baby, you come in hot. You have to sit through. You have to get the IV. You got to sit through the IV fluid bolus. Then you got to have the anesthesiologist come. Actually, put it in. You're talking 30, 45 minutes by the time that's all going to happen, as opposed to and enduring the contractions during all that, as opposed to pushing a couple times and having a kid. It's easier for them, honestly, in the long run, just to push and have the baby. It's less pain, you know. But
But they don't want to hear that in that moment.
no, and you feel so bad for them.
Yeah.
And those are some of the ones that you lose a little bit of your, like my life expectancy from those moms who are like bringing their legs together, because they're just in this like, they're in this other world that
Yeah.
they're just
Have you
in
ever
so
been
much
kneed
pain.
in the head?
No, but I've been cursed at. Like they're, you know, like fuck you, be fine. And I'm like, okay, I'm like, we're holding their legs apart, because that's when bad things happen. Is when they, you know, they're closing their legs, they can't get the shoulder or something, and then after the baby comes out, they're like, oh my God, I love you so much, Dr. Crum. That was so awesome. I'm like, you just totally like yelled at me and were like screaming F-bombs, and oh God, it's so funny. Yeah.
It's kind of like having a teenager.
Exactly.
Teenage daughter, at least. I
Yeah.
can speak to that.
I love
Yeah.
that. I
sure.
see. I think labor is like I think it's the best thing ever. I love it. I've loved it
I'm sorry.
both times. I love labor. I know. And when I say that, people always look at me cross-eyed. But like pregnancy, like 10 weeks of it's pretty cool. Like, you know, weeks 22 to 32, you know, like,
much, yes.
you know, like you're like, this is cool. I love this. And then it's like, okay, I'm over it. Let's get on. But labor, I think
What exactly did you like about labor?
I loved all of it. I loved
Clearly, she had a good labor experience.
Clearly.
I loved all of it. I
Clearly.
loved the pain of it. I loved like getting out on the other, like, I don't know. There was something I loved pushing. I don't know why. It was like for me, it was a very like just empowering experience and very.
That's super cool.
Both of them were very different. Harper, I was like inward and like in my body, in pain, but in my body. And with my son, I was like an animal. Like it was crazy. At one point, my husband's like texting and I'm like, put your fucking phone down. And he looked at me, he's like, it's your dad. I'm like, I don't give a fuck who it is. Like and I'm really sad that I didn't film both experiences, either one of them.
Really?
Film. I wish I had both of them filmed. Even my son, when I was like making involuntary noises and like movement, and I'm like, well, I have no control of my body right now. It was
my first baby, my first daughter. They pulled out. Do you do this? They pulled out a mirror so I could watch.
Yeah, if they want it.
Yeah, I didn't ask for it.
Really?
And they just
weird.
I didn't get a mirror.
To be fair, I had an old school doc who gave me a lot of drugs, and so I was really out of it. They had to wake me up to push. Like that's how out of it I was.
Oh wow!
So I may have agreed to the mirror. I'm not sure, but I definitely remember the mirror.
It helps people push.
Is that what it is?
If they see like how they're pushing and they see the baby's head move, then they know
give some
where
motivation.
To push. Yeah.
Oh,
yeah.
Okay. Maybe that's what they because I was so loopy. Yeah.
Yeah.
But
wow,
you're probably just a shitty pusher.
Does that surprise you?
Sorry, I'm just kidding.
You're absolutely right. I'm sure I was a shitty pusher.
Well, you were probably super drugged up. So, yeah.
Well, no, I probably was. I was a shitty pusher the second time around too. So,
because trust me, they're like, after I've been pushing for like an hour with the patient, I'm like, let's try. What else can we try? I'm like, get the mirror.
So like, that's a real thing. Like
sense.
People, how come people can't push?
Mostly because they're numb.
Like
they're
too numb?
Yeah. And they just can't feel like any pressure, anything to where to push, or they're pushing in their legs and their face and their every place else but their butt. And yeah. And some people just are not good pushers.
Really?
They're like, ugh. I'm like, oh my God. This is going to take forever.
Oh my gosh.
See, this is why you weren't my OB.
That's amazing.
Actually, you weren't my OB because
Come on,
I
Cindy.
could not imagine
Get it
you
together, girl.
looking at my pink parts after we've been drinking
Oh my gosh.
through college and then, happy hour. Hey, you just checked me out.
Yeah.
Here we are. I know on your end, it's like no big deal.
No.
I get that. Like you don't even put two and two together. I just, and I have many friends who go to you who love you and love the experience.
Yeah, it's totally a personal thing.
It's the immature side of me. I just
It's not
couldn't do it.
immature.
A little bit.
But I delivered quite a few of my friends.
That's got to be really
But
cool.
but I'm so glad that phase of life is over because it was like super stressful.
Yeah.
And I had first started out like you're so dumb. Like you're like, yeah, I'll deliver you, and you're just so new. You're happy to have a pregnant patient, and then now looking back, I'm like, oh God, it was so much harder because God forbid something really happened because shit happens in OB and like it's hard enough when it happens to somebody that you don't know personally, but when it happens to one of your friends, it's like, oh, I mean, thank God nothing bad ever did. But I'm really glad that phase of life is over.
Yeah, that makes a lot of sense.
Yeah.
Mm-hmm. Yeah.
So as we've like now just spent the last, I don't know how long talking about pushing out
this
babies.
might be a 2-part series.
I love childbirth. That's why I'm like,
But that's
This is
awesome
great.
that you have that.
You were kind of like Eeyore coming in here, and now you're like Tigger. Like, all right, childbirth, here we go.
I came in after sitting outside. I was like sweaty.
I
and my
asked her
daughter's
if she
soccer
needed a
game.
glass of wine.
Yeah,
That's what
it's true.
That's
Now
how
I'm
it
like,
looked.
let's talk about pushing out babies. It's my superpower.
Too bad you can't do it again.
I know.
Well, she almost
my
did,
one thing
January.
in life that I wish I could do again. What'd you say?
January, you thought you were going to.
Thank God, because I didn't happen. I could have died. So
Yeah, no, you don't want that.
that's what I've learned today.
Yeah.
So overall experience as an OB, what's, I would say, like, I don't want to say your greatest takeaway of your career, but like, what has just that experience meant to you and where you're at?
I have a wonderful job. Like I run into patients literally everywhere I go. One time, Eric and I, we were on our way to Park City. We're in the middle of nowhere, Utah, at a roads like a gas station, and we have the kids, and I'm inside getting sandwiches, and Eric's like, one of your patients is outside and wants to show you the baby. I'm like, what?
Oh my gosh.
Oh, I love that.
I mean, we've run into patients in Hawaii.
Wow.
Can I
crazy.
tell his favorite story that he tells? He's you might not remember. I'm sure you remember. As soon as I start, you'll remember. So Eric is an airline pilot, and he was somewhere overseas, and someone
in Sydney or something.
yeah,
in
in
Australia.
Sydney, Australia, and one of his like higher ups, maybe.
I think
or
he's below him
somebody-
actually.
Okay,
But yeah,
was like,
another pilot.
oh, you're is he a
It's
captain?
like, are you Eric Crum?
Yes, Eric Crum.
Oh, he was famous. Famous by marriage.
So of course he gets like all like, yeah, I am, and he's like, this guy's gonna ask me some advice. He's gonna tell me how great I am. He's like, your wife is amazing.
Oh, I love that.
She delivered our child, and it was the most, and goes on, and Eric's like, like deflated. But then of course, then he was reflated because he's very proud of his wife. He's very cute when he
I
talks
love
about
that.
you. Yeah,
It's funny.
That's
So-
such a special relationship, though. Like you're a
is.
patient and their OB. Like that is.
Yes,
I feel like
totally.
that is that's an experience that no one forgets. Like that
For sure.
relationship and yeah. So it can either.
And being lucky enough to be a part of so many I have a great job in that. Like I love all of that aspect of my job.
How have you balanced the demand of being a physician and having a family?
Well, I don't think I've done very well at that,
Yes,
considering
you have. You've done a phenomenal job.
some of the issues my kids are having. But
Some days are better than others. It's fine.
yeah, it's hard. I mean, you guys know it's really hard. And when they were little, I used to have to we covered all of our own deliveries. And so I remember, and my husband is pilot and is gone 4 days a week, 3 days a week. So I'd be having to call my dad over at like midnight to come and watch the kids while I go do a delivery and come back. And that would be like every other night. And
Can you imagine?
it was hard. I don't know how I did it.
Middle of the night. I don't know how you did it either.
I really don't know how I did it for so many years. Now we don't do that. We have our on-call night and cover each other, and it's 1,000 times better. But that's the only downside of my job is the call.
Yeah,
The call as I get older is a lot harder on me.
I'm sure. Yeah,
Like I think about it, I have anxiety about it the whole day and how hard the next day is going to be because now not only I'm tired, I haven't slept, but now I got to go work and then be a mom. And
how often are you on call?
average like once a week.
Okay.
So
Yeah,
and it's hard.
Back
I
in the
hate
day,
it.
you delivered all your patients, right? Like that's kind of how it works.
And it helped build my practice.
Yeah.
So, I mean, I'm glad I did it, but there's no way I could do that now.
Yeah, that's tough.
It's not sustainable. Like, it's really not. You think about how tired you are when you don't sleep at night, but like if I delivered all my babies, I would literally be at the hospital probably 3 nights a week.
Oh my gosh.
Like, it's just not,
No,
Yeah,
it's
that's
not
not sustainable.
No.
So I'm a much nicer person now that but I think when I was young, starting out, like I probably was a little shorter with my kids than I should have been. And, because I was so tired.
We
I'm just
were all
so
tired and we were all short
exhausted.
with them.
Yeah.
But yeah, I mean, I think that's been the biggest struggle of my life is that balance. And I think every woman struggles, every working woman struggles with that.
It's so true.
It's so hard.
And then with your husband gone, then you get home from being exhausted and you're in charge
Yeah,
because he's flying.
right. And so, I mean, I remember just going home like, okay, now it's go time. Now I got to like get dinner on the table, baths, the whole nightly routine. And I would literally fall into bed at like 9, just,
Of course you did.
and so that part has gotten a little easier as they're more independent, but it's still hard.
Yeah.
Because still, despite the fact that I have a very hands-on husband when he's home, and he'll do a lot of the chores and everything, but I mean, let's be real, all the planning, all of that still is done by me.
And there's just something with the kids that they naturally just default to mom.
Innately. Yeah. I mean,
100%.
yeah.
Like you're the one who knows the schedule. Like I can tell my husband, go do that, but I still have to you're still the one organizing everything.
You're still responsible for it. Even though you told him go do that, if it doesn't get done, you're the one that's responsible for it.
Yeah.
Yeah, which I'm not sure how that math works, but
I don't either. And I don't, you kind of hope that, and I think it's better. I mean, you look back at our parents.
Oh, yeah.
The moms probably did 95% of everything, you know?
Right. Well,
but
if you had a good one,
that is a really good point, Cindy.
For
I
later,
second that.
Another episode.
Yeah, let's not even go into
Down the road.
bad moms now. Because I'm always going to be better than mine was.
There you go.
I hope I am too.
You hope you are.
Yeah, and I mean my biological mother, not my stepmother, who's fantastic. Let me clarify that in case she ever listened to this.
That's something that I would say I'm so grateful for, is that I do have my husband stays at home with the kids, and so he is great at juggling, the schedules and all the different, parts of life.
Making your coffee, packing your lunch.
Yes. It is true. It is true.
I know, right?
It's fantastic.
You got a good one.
She does.
And I will say, as soon as I walk through the door, it's like the kids
flock to you.
Yeah. And if I'm home, and when I get it, it's, and I'm exhausted, and it's, I don't know. We're still trying to just figure it out and do the best I can. And then I'm like, how much am I fucking them up by being gone and working and doing?
We are all doing our best at fucking them up. But it's just,
it's always guilt. It's always, your life is driven by guilt. I mean, to this day still, you know, like I'm like,
oh, for sure.
Cindy and I went on a little weekend getaway last weekend, and I was like,
she was feeling the mom guilt.
For
2 days we went for her birthday, 40th birthday, big, and I get it. I mean, I felt that.
Totally. But you know what? This is what I always tell my patients, because they come in lamenting a lot, like, I'm so tired and this is so hard. And I think you learn better as you get older to say no. And when you're young,
So true.
like, you try to take on the world and be everything to everybody.
Be a people pleaser.
Yes. And I was 100% that. And then as I've gotten older, I'm like, no. Like, the answer is no.
Yeah.
And I cannot take that on. And, and you do get better, and you learn to prioritize that your kids are the most important.
Right.
For sure.
You just said something that I feel like is important to talk about too, is women coming in, after, I think especially for me, my experience after having my first child, I thought, I mean, I've been raised around kids my whole life. Like, this is fine. Like, no big deal. It should just be mine now. Like, and it was a rude awakening after, and she was hard. Like, my daughter, she had reflux every time she ate something or didn't eat something. I feel like we were covered in puke all the time. Like, we we'd put a beach towel on the ground and we'd get a bowl, because I'm like, how much is she puking every time she ate? Like, and she was a chunk, so the doctor, the pediatrician's like, she's gaining weight, she's okay, but she was just so uncomfortable all the time, and so it was not like, there was that that added to it, and then exhaustion, and I want to say, gosh, I don't even know, maybe 3 or 4 days after I had her, because I went home like the next day. So maybe I was home 2 or 3 days after that. I had a fever of 104.
Ooh.
And had to go back into the hospital, and was in the hospital for a few days. And so that, I think, that was hard, but it just,
for sure,
it was that experience of being like, oh my gosh,
your world gets
what
rocked
has happened.
after that
Yeah.
one. Like, you look, and like, everything just got completely turned upside down.
Yes.
And you can't prepare anybody for it.
Right.
Like, until you're in it. Like, you just can't ever have
You can't imagine what it's going to be like.
Right.
And it's different for everyone too.
Right.
It really is.
Yeah. The ones I really worry about are like I've had patients, they'll be like, I can't deliver on that day. Like, that doesn't work for me. I'm like,
oh no.
Oh, you just put that out in the universe, and you do realize, right, that like, you no longer have any control over your life once this kid comes out. Yeah. And those are the ones I really worry about adapting to parenthood, because they're so set in their ways, and they just had this like, no, that just doesn't work.
Yeah.
I'm like, you're for sure delivering on that day now, by the way.
Yeah.
And, you know, they tend to struggle more because, and it happens in older women, I think, because they're so set in their ways.
Yes, that makes sense. Because,
you know?
Yeah.
How do you support women through, like, what the woman coming in who, you know, is their first appointment, you know, after bringing in the baby and is just like, what have I done? Because I think that's a real thought. Like your life, and I don't think people talk about it because you feel
different
guilty.
than postpartum too.
Yeah.
Yeah.
Well, it's just
because that's just like acclimating to a new situation.
Yes.
Right.
You know?
Change, a big change.
Right. And I tend not to see them until like 6 weeks. So by the first 6 weeks, they've kind of gotten a little better.
They've gotten a
handle
little
on
sleep.
things.
Yeah. Maybe.
Yeah. But, you know, I think my biggest piece of advice to them is like, you have to take care of you. Like you said, your self-care earlier. And that is so important because if mama's not happy, nobody's happy.
The whole house
and
is
it is
unhappy.
okay to find time for yourself. It's necessary.
Hear that.
Even if it's going and like sitting at Starbucks and playing Candy Crush for 2 hours, because that's probably what I would do. Like, at least you reset. And then you're like, okay, I can tackle the rest of this night, you know, or the rest of the week or whatever. Like you have to find time for yourself. And I am the worst at it. And I remember being, when my kids were young and Eric was gone all the time, I would pray for like an hour of alone time, an hour, because I never, ever, ever got alone time. But then I was like, I just have to make this happen for me. Like I have to.
Right.
And
also the lesson there too is reach out to our girlfriends. Like
Yes.
as you're saying that, I'm thinking, I would have been happy to take your kids for an hour. You would have been happy to take my kids for an hour if you had it. You know what I mean? Like we don't ask for help. We're so bad about it.
Yeah.
We're so bad at like thinking that we're putting someone out or burdening someone. And in reality, I would have been honored to take your kids for an hour so you could take a nap, right? And vice versa. But we don't do it.
no,
We don't
because
do it.
those are the things that you learn with age.
right.
Yeah.
You
That's
know?
why
Right.
grandparents see it totally differently.
Right.
Yeah.
And like now I'm at that phase in my life where I could be like, Cindy, I really need this. And you would
Right.
do it. And I know you would. And I wouldn't, you know what I mean?
Right. Yeah.
I think there's so much pressure and just exterior, like what we put out into the world of like what motherhood is, right? So people are consuming, you know, these beautiful lives, and it's like, you know, the reality of, I truly believe having your first child. I mean, every child is different. Thankfully for me, the adjustment to having a second was way easier. I did wait 5 years to have my second child. So my husband and I, we were already older parents when we had our first, and then so different kind of hard, I would say. But I think what the world tells us we're supposed to say after we have a kid of like how great it is and how like, you know, it is so misleading. And so I think there's a lot of guilt and shame associated with, for women going like, ooh, like,
This is hard.
This is hard.
Yeah. And depending what you follow on social media,
Right.
right? It's all unicorns and
Sunshines
rainbows.
and-
yeah. And it's like,
Yeah, and that is not true, especially in the
No.
teenage years. God, I keep going to that. Sorry.
no, it's valid. Very fair for all of us here. She'll know soon.
I know.
Soon enough.
Gosh.
Yeah.
Oh, no.
Hopefully mine will be out of that by then. And then I'll be able to be like,
How many years of the teenage years?
I don't
All
know.
of them.
My son has been hard since he was like 18 months old. God love him. But
Your son is the second, too.
Yeah.
Okay.
he's been the hardest thing I've ever done in my life. I hate to say that. I love you, Evan.
And also the best.
Yes.
Yes.
The most rewarding
Yes.
because it's been the hardest.
Yes.
Yes. Yeah. I get
Yeah.
that. I do.
But and
Parenting's hard.
it is. And they're all different.
They're
like
all
it's amazing. They come out of the same vagina and
Yep.
the same gene pool,
Yep.
and yet they're like polar
And
opposites.
It's
zero
crazy,
instruction
too.
manual.
Isn't that what I know? And no zero instruction.
instruction
My husband, we still joke about this, but it was like when we brought Harper home, he's like, they just let us leave. Like they just let us leave with a child.
Right.
And like nobody's coming to check. And then he would think that they were keeping score. Like, I'm like, they are keeping notes, but like, he's like, that's a ding on us. The pediatrician, that's
You
a
did
ding.
not write
They're gonna
down
take her
how long
away.
you fed for.
Yeah.
That's it.
He's like, That's a ding.
She has diaper rash. She's gone.
Yes.
CPS is coming.
We would show up together to every pediatrician appointment because he wanted it noted in her chart that both parents were present.
Oh, that's
And
too
now
funny.
we know why he's the one to stay home.
He's like, I'm not getting the ding.
I love that.
I
That
will
is
be
so
yeah,
cute.
it was crazy where we were like, they just let us leave and nobody's coming to check up.
Yep.
There's no instructions. There's no, like, it is pretty wild to think
wild.
that. But
Well,
anyways,
Speaking of sweet husbands,
Yeah, go ahead.
Dr. Crum is meeting hers for lunch.
Yes.
And we are keeping
Oh,
her.
no, this has been really fun.
Thank you so much for what
Thanks
you
for
do.
having me.
Thank you
Yeah.
for coming on here.
Yes.
That was
We
super fun.
appreciate it.
I love that you guys do this for women. And it's good because women need to be built up and,
Yep.
you know,
And supported.
and supported.
Yeah.
Thank you so
Absolutely.
much. Thank you. As
Thank
always,
you,
I'm
guys.
Danielle.
And I'm Cindy. Thanks for joining us.
If you liked today's episode, please make sure to like and subscribe below. Also, follow us on all of our social media platforms at Unapologetically Females.